Namaskar, good morning, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring in Apollo's health experts to this live show where you get a chance to ask all your questions and queries, and our experts will answer your questions. If you want your answers, if you want your questions to be answered, please do ask your queries only on the YouTube chat box. You must be watching this on my Facebook page or Apollo's Facebook page. But if you want your query to be answered, make sure that you are typing your question in the YouTube chat box. And also make sure that you type in all the details in one question, in one box, comment box, and wait for me to take up the answer. Make sure that you give your age, gender, and specific problem. Today, it's going to be a very interesting session because we're going to have two experts, not just one. We're going to have two experts. We are going to talk about joint pain. तो आज के experts से मिलते हैं. We are going to consult the specialists and get your questions answered. So, if you want to ask any question to the specific doctor, make sure that you type your specific question to the specific doctor. आज के फर्स्ट एक्सपर्ट से मिलते हैं डॉक्टर शेखर रेड्डी गुराला, who is an anesthesiologist and a pain physician from Apollo Hospitals, Jubilee Hills, Hyderabad. With experience more than 21 years, Dr. Shekhar Reddy Gurrala can be consulted for back pain, neck pain, facial pain, joint pain, and cancer-related pain. There, Dr. Shekhar Reddy has joined us. Namaskaram. Good morning, sir.
Good morning. Thanks for having me here.
Yes, doctor. So Dr. Shekhar Reddy is from the Telugu speaking states. He's from Hyderabad. He'll be able to speak and communicate in Telugu as well. So that the Telugu audience andarki appudu Dr. Shekhar garu Telugulo kuda answer istaru. Yes, doctor. Welcome once again. And our expert orthopedist for the day is Dr. Amit Kumar Agarwal, who is an orthopedist from Apollo Hospitals, Indraprastha, New Delhi. And Dr. Amit is going to join us from Delhi, who is experienced with 12 years, more than 12 years of experience in Inka. And Dr. Amit ji can be consulted for back pain, neck pain, facial pain, joint. I'm sorry, Dr. Amit Kumar ji can be consulted for all orthoscopic knee replacement, joint replacement, and all other orthopedic issues. Good morning, doctor. Welcome.
Thank you. Thank you for having me here. Privileged to be part of this.
And yes, Dr. Amit ji speaks predominantly Hindi and English, and all the audience who understand Hindi में जिनको भी comfort है, अगर आपके questions अगर आपको हिंदी में चाहिए, तो please make sure that you ask your question to Dr. Amit ji in Hindi as well. So welcome, both doctors are here. Let me first congratulate Dr. Shekhar Reddy garu. World Anesthesia Day hai aaj. Thank you for being here on this international world. No, it's a World Anesthesia Day. Please correct me if that's the right term to use.
Yes. Thank you.
Yes.
Sure.
When we talk about pain, especially joint pain, yeah, I totally understand because I live with parents who are elderly. I also have gone through pain. I remember, Dr. Shekhar Reddy, I should tell you this interesting thing that I had to visit a pain specialist, get injection done for my shoulder, and then get to work. There were times when I was doing a quiz show where I couldn't even stand and lift my hand. So much was then of course later I worked on it and I'm much better. But I should thank the doctors to have helped me that moment. Pain. Joint pain. Let me start with Dr. Shekhar Reddy because today is the day of anesthetist as well. How can a pain specialist help in joint pain?
Sure, Jansi. Actually, it's a good question. Though, first of all, to start with, any patient or any person coming with pain to hospital, usually see they come to a specific doctor. For example, if they have bone pain or joint pain, they go to an orthopedic surgeon. If they have back pain, they go to a neurosurgeon or neurophysician kind of thing.
G.
And the people, those who see the patients, the doctors, sometimes they don't understand how to deal with it when it becomes a chronic pain. That time, the role of a pain physician comes in. So, pain itself is not a disease, it's a symptom by itself. Sometimes it is disease by itself, which can be cured with medication and small interventions. That's what we do.
यस सो आज हम लोग जॉइंट पेन के बारे में बात करने वाले हैं. डॉक्टर अमित कुमार अग्रवाल जी है जो ऑर्थोपेडिस्ट है. एंड सर वी नो दैट द मोमेंट that there's something related to joints, we always head to an orthopedist. So let's
Yes.
understand what our joints are, what's our musculoskeletal system like, and which are the joints, which and why is this joint pain? Who experiences this joint pain?
Yeah. So to understand the joint pain, let us first understand the joint. Joint itself is an organ. We don't consider joint as an organ normally, like heart is an organ, kidney is an organ, but then joint itself is an organ. It's a beautiful organ, rather, I must say. And there are parts and components of the joint, like any other machinery. We have a beautiful joints in wherein we have a cartilage that is a smooth surface that glides over each other, and we get a pain-free movements. Then there are
Okay.
some ligaments, there are some tendons, there are some capsules, soft tissues around the joint. So any pathology in any of these things can lead to the joint pain. So as an orthopedician, it's our duty that we have to rule out the exact cause of the pain. So most common cause of pain is arthritis, like osteoarthritis, which is quite common in elderly, or maybe inflammatory arthritis, which is quite common in younger populations.
जी.
So there are various causes, multifactorial in origin.
हाँ, तो एज का क्या नाता है? How does age come into effect? And is it right to say that only elderly get such kind of joint pains? How about youngsters, Dr. Amit?
No, there are certain type of pain like wear and tear or degenerative or osteoarthritis that is quite common in the elderly population. But nowadays, especially after COVID, you will see a lot of young patients also coming with a joint pain. So it could be because of the bad posture, or it could be because of the immobility, or the patients are not walking much because of the COVID. Also, they are working from home, so that could be one of the reasons. Or there could be some set of arthritis which is quite common in younger population, like inflammatory arthritis. So we cannot say
Right,
that
right.
age elderly population get the arthritis or joint pain. Younger population also, they are prone for certain group of diseases which causes the joint pain.
Well, so let me ask this question to Dr. Shekhar Reddy. Whenever you are in your clinic, what is the age group of people who come up with pains, especially joint related pains? Any younger population specific cases that you have seen and you would want to share some information there, sir?
Sure, Jansi. Actually, see, we see somewhere between 12 years to 94 years of age. I have seen different patients. The patient, they usually come with a back pain. So this is our back, right?
Yeah, doctor, a
See,
little inside, doctor, towards you, body to, yeah,
right.
that's it.
This is the skeleton. Okay.
Yes.
And wear and tear can happen in anywhere. Actually, this is the joint. Okay, this is again a joint. Anywhere it can happen. This one is the joint again. See, right?
So, how many joints do
Okay.
we have, Dr. Amit?
It's
The
more
entire
than
body?
208, you can say, in the as a whole in
Eight
the
bones
joint.
to hai, 206 bones to
Bones.
hai. So
Yeah,
around
bones. Yeah.
300, yeah. According to my knowledge, I think it's around 360 joints that we have.
Yes, yes.
According to the internet's knowledge, I'm sorry.
That's fine.
Let me.
So whatever the joint, actually that can be a source of pain, right? So this is
Yeah.
a back pain. The most back pains are treatable easily. 90% of the pain, they are self-limiting. Only 10% needs address, and out of 10%, only 1% or less than 1% need surgery. So others
Acha.
can be cured. Okay,
Okay.
easily.
Okay.
Small interventions and medication. Okay.
Okay. So let me quickly, before we get into the other kind of surgical and age related issues, younger issues, let me talk about the elderly populations, which might constitute the larger group of joint pain people suffering with joint pains. तो age related joint stiffness क्या होता है? Dr. Amit, can you please explain what is stiffness
Yeah.
around joint and degeneration or
Af-
wear and tear?
Yeah, after pain, you can say stiffness is one of the most common symptom patients present with whenever there is a joint pathology like arthritis. So they will say that what is stiffness? Stiffness is the restriction of movements. A joint is supposed to move to a certain degree, but then when there is a stiffness, they will not be able to move it completely. So why it happens? This is the most common sign of arthritis. Any arthritis, especially the elderly population, they will complain of pain as well as stiffness. That means restriction of movements, right? So that is a
Correct.
classical sign. If you have a rheumatoid or any inflammatory arthritis, the stiffness will be prominent, and early morning stiffness. Especially, patient will tell that in the morning they find it difficult to move their body and joints for maybe half an hour or so. So you can say it's a sign of arthritis or any pathology in the joint. They can present as a stiffness.
Okay, so is this kind of only in the aged or the elderly population, or is it also in the
No,
inflammatory arthritis section?
yeah. In fact, it is more common in inflammatory arthritis, which is quite common in younger population. So
Uh-huh.
we cannot say
Uh-huh.
that that is a sign of elderly uh, joint
Okay.
disease. So, right?
So the stiffness can occur into any age group and any
Yes,
gender as well.
yes,
Well,
yes.
I totally understand this because I have my relatives, my friends who suffer from this kind of mobility issue because of stiffness. उनको बहुत मुश्किल होता है, स्पेशली ट्रैवल्स में उनको बैठने के बाद एयर ट्रैवल और ट्रेन ट्रैवल में बहुत मुश्किल होता है. So let's talk about management of such issues. Dr. Shekhar Reddy, what do you have as a pain physician to offer, especially in joint pains?
Now, in joint pains, there are multiple joints which can give rise to pain. So, it's a back pain. There is a different kind of treatment. If it is a knee pain, for example, see, this is the knee, right? I can say,
Hmm.
right? This is the cartilage in the knee.
G.
Okay, this one. Okay, so when there is a wear and tear of the joint, so wear and tear can be of multiple reasons. One can be trauma. Trauma may lead to wear and tear. In younger people, they will have joint pain, and the people those who are elderly, it's because of the age-related wear and tear. And
Hmm.
whenever there is more than grade 3 or grade 4 stage of arthritis, we refer them to Amit for joint replacement. And the people those they don't want to have joint replacement for some reason, for example too young for a joint replacement or too old and not fit medically for going for joint replacement. For those patients we offer, it's a radio frequency ablation of the pain causing nerves, so that will give them symptomatic relief. That is not an alternative for the standard treatment. That will give
Yeah.
symptomatic relief. And other
Right.
things, back pain, so we have excellent treatment options.
Great. So, Dr. Amit, now that we come back to surgery and non-surgical options in your purview as an orthopedic surgeon, so who has to go in for the surgery, and when is the surgery an option, and what kind of surgeries are available these days?
Yeah, whenever the patient is not responding to any conservative management for a certain period of time, let's say after 6 months, they have failed all conservative options, including injections and lifestyle modifications and medications. So we have to counsel them for the surgical options. And surgery depends on the type of pathology. Like if it's advanced osteoarthritis, which is involving only the one side of the compartment, and the patient is relatively younger, in the case of knee, we can go for the correction of alignment, or you can say high tibial osteotomy. Nowadays, we have an option of replacing only half the joint. We call it unicondylar replacement, right? So that is also one of the options if patient is relatively younger and they don't want to go for total knee replacement. And in advanced disease, when whole of the joint is affected, we have to go for complete replacement or
Treatment.
total knee replacement, right? So these are the various options. So many other options are also there depending on the exact cause at the stage of the disease.
Yeah,
And I would
that's
like to
perfect.
add one more point.
Yes,
Jansi,
Dr. Shekhar.
I would, yeah. The thing is, whenever there is a grade 1 or grade 2 cartilage damage, in those cases we have the regenerative therapies also. So where the platelet-rich plasma and other regenerative materials can be injected into the joints, and that will regenerate the joint.
This is an entire subject of audience's curiosity. I'm sure people are going to ask more questions about the treatment options. I'm going to take audience's questions in a very short while. But one quick question, as Dr. Amit was saying, कि COVID के बाद joint related issues काफी आ रहे हैं. Is it only because of lack of mobility and lesser of exercise that we were forced to be indoors for a very long time, or does COVID per se pathologically does have any kind of effect on our musculoskeletal system?
Yeah, COVID sometime, no, when you get a viral fever, you get a post-viral arthralgia. It's a kind of autoimmune disease. So not in
Gee.
all the patients, but yes, we have seen in certain group of patients who had a severe COVID infection a couple of years back. So they presented with a joint pain similar to post-viral arthralgia. So yes, COVID, in fact, COVID has touched all the systems in our body. So it has also not left the musculoskeletal system. So that is one thing.
Ah,
But mostly more patients are affected because of the lockdown, because of the change in the lifestyle, work from home. They are not going out, so they are deficient in vitamin D because sunlight exposure is less. They have put on the weight. The diet is not good. Ergonomics is not good. So many, negative points with that. So overall, it has changed our life.
yes, doctor, I do totally understand and agree. And I'm now moving on to the live questions. I do have a lot of questions for both of you, but I understand that audience come first and their questions should be taken as a priority. So let me start with our audience's questions. Uh, there's a question, a lot of question about stiffness, pain, not able to move further. So how do we understand? Let me give you a name. Oh, sorry, my thing got stuck. So yeah, in the meanwhile, while I kind of bring in the names and their questions, well, my YouTube has responded. Thank you. Just a second, doctor. This is Sadat Banu, and the age is 50. I have autoimmune disease. Because of that, I have arthritis in my legs. Often my foot gets swollen. What should I do? So, arthritis and an autoimmune arthritis by itself is an
Yeah,
autoimmune disease, right, Dr. Amit?
yeah, yeah.
So,
Yeah.
which
Autoimmune.
joints can these? Huh?
Yeah,
Please continue.
autoimmune is one type of arthritis. We call
Oh,
classify as a inflammatory arthritis, and essentially initially it's a medical management. So they need to consult a clinician, whether rheumatologist or orthopedician or pain specialist, to make sure that they are on proper anti disease modifying drugs. So they have a very good roles, and we have a newer agents also. They work very good. We are getting very good result out of it. So they need to consult the proper clinicians.
right. So one quick question again on arthritis. Vinay Chauhanji, good morning, doctors. My mother has finger joint pain and signs of arthritis, but during medical checkup, reports don't show arthritis. Why is it so? Uh, who would want to answer, Dr.
Yeah,
Amit or Dr.
in the initial
Yeah.
stages,
Both.
the radiological changes may not be there. So it's a clinical like synovitis or something, tendinitis kind of presentation. So they will not be evident on the X-ray. So we have to, if the clinician thinks that we need to further escalate the radiological investigations like MRI or ultrasound can be advised.
Okay, Dr.
No,
Shekhar
to
Reddy, would
add
you?
to the yeah, to add up to the Amit just answer, sometimes the knee pain, joint pain, or hip joint pain, or ankle joint pain, they may be the symptoms of remote problem like spine problems. So
Yeah.
they need to be examined properly. Then we can
Yeah. Yes.
treat.
So आयुष पटेल जी पूछते हैं थोड़े जनरल टिप्स दे दीजिए फॉर पीपल सफरिंग फ्रॉम रुमेटॉइड आर्थराइटिस डॉक्टर अमित जी.
Yeah. Take healthy diet, do regular exercises, consult your doctor on regular visit, because most of the rheumatoid patients, they are on disease modifying drugs, and we have to titrate those the doses, and the duration and everything has to be tighter. So these are the general tips: diet, exercises, yoga, and medicines.
Great. So, next question is Sridhar Anne. Knee pain has started and sometimes I have swelling. What is the remedy? Shekhar Reddy garu, I think తెలుగులో కూడా కొంచెం చెప్తే ఏ టైంకి ఎప్పుడు కన్సల్ట్ చేయాలి పెయిన్ స్టార్ట్ అయిన వెంటనే వెన్ డస్ వన్ హ్యావ్ టు కన్సల్ట్ అండ్ పెయిన్ ఇన్ ద నీ వాట్ ఈస్ ద స్టేజ్?
సో పేరేమన్నారండి?
శ్రీధర్ అన్నే సారీ.
శ్రీధర్ గారు, బేసికలీ పెయిన్ అంటే పెయిన్ ఏదైనా నొప్పి తర్వాత ఏమైనా గాయమైనప్పుడు కానీ ఏదైనా అయినప్పుడు కానీ సో జనరల్గా మనం నెగ్లెక్ట్ చేస్తూ ఉంటాం. పర్లేదు కదా, ఏం కాదు, తగ్గిపోద్ది అని ఏదో మందుల షాప్కి వెళ్ళేసి మెడిసిన్ టాబ్లెట్ తీసుకుంటాము. ఒక 2-3 రోజుల తర్వాత కూడా మనకు పెయిన్ తగ్గట్లేదంటే ఇమీడియట్గా మీరు డాక్టర్కి వెళ్ళి చూపించుకోవడం బెటరు. ఏదన్నా నొప్పి 3 నెలల కన్నా ఎక్కువ మిమ్మల్ని బాగా ఇబ్బంది పెడుతుందంటే డెఫినెట్గా మీరు పెయిన్ ఫిజిషియన్ చూడాలండి. చూస్తే సొల్యూషన్ దొరుకుతుంది.
Yes, thank you. Very positive reiteration. Any pain that is more than 3 to 4 days, do not neglect it. A pain that is continuing for 3 to 4 months calls for medical attention. That's what Dr. Shekhar Reddy sir has been saying in Telugu till that. Dr. Amit, here's the next question. Sunil Aswalji पूछते हैं, knee pain since last 3 to 4 months. Climbing stairs and coming down is very painful. So this is not just his question. I understand that a lot of audience must be having such kind of issues.
So, what is his age, Mr. Sunil?
Uh, Unfortunately, he's not put his age there, and I request all my
Yeah,
audience to
yeah.
kindly
So
type your
we are,
age.
yeah.
Helps doctor to understand your situation better. Yeah.
So let us say he's a young chap. So considering in knee pain in a younger population, we have to do certain basic tests like vitamin D, uric acid, vitamin D. These are the important things, and we have seen 70 to 80% of patients presenting to us clinicians they are vitamin D deficient. That is also, it has been one recent study shows that vitamin D deficiency leads to the early erosion of the cartilage and making them prone for osteoarthritis. So these are the things we have to do basic investigations. And as a whole, we can say that they need to do regular exercises to strengthen their thigh muscles, quadriceps, the front muscles, the hamstring, the back muscles, and they will support the knee joints. And weight is also one of the concern. If they are overweight, they need to reduce their weight. They need to maintain their ideal body BMI according to their height. So these are the things we can say as a whole. Precautions need to
Yeah.
be taken, right?
Great, great. Thank you, sir. So, Dr. Shekhar Reddy, as I understand that you also relate to cancer-related pain management. I'm not sure if this is exactly cancer-related pain management question, but I will pose it to you. But doctors, please feel free in case you want to add anything here. भारती जी का क्वेश्चन है, लंग कैंसर पेशेंट है ये, metastasis in bones. With targeted medicine and bi-monthly Zometa infusions, my cancer is stable, but I have pain in my left knee and left shoulder. Doctor do say that it is osteoarthritis. How can we help her?
No, sure. Actually, see, this can be osteoarthritis, may be age related. This may not be related to the primary disease, which is under control. And this pain can be treated when the patient is examined and properly investigated. Then we can take a call how to treat. And as for the shoulder pain, there are multiple treatments for shoulder pain. If there is any shoulder ligament damage or anything that can be repaired by an orthopedic surgeon, if that is not feasible or possible, we have other modalities of treatment like we can do joint PRP injections and denervation of the joints by radiofrequency ablation. Even knee also same thing.
Yeah. Dr. Amit, would you want to add something here?
Yeah, yeah, definitely. First, we have to make sure that what stage the disease is. Sometimes, it's early disease, the management will be different. It's advanced disease, the management will be different. So, first clinical examination, and then investigations to make sure the disease stage
Yeah.
is
Now
there.
I'm Yeah, totally understand that certain questions cannot be answered in elaboration here on a
Yes.
virtual platform. In clinic, yes, you might be able to evaluate it better. Well, both the
Okay.
doctors can be consulted on Apollo 24/7. Do download and make sure that you have the right expert in your hands. Oh, quick question again concerning a lot of population. Fit origin इनका नाम जेंडर एज कुछ दिया नहीं है कुछ दिया नहीं है. हमारे एल्बो में पेन था, डॉक्टर ने बोला टेनिस एल्बो, उसके बाद हमारा राइट हैंड डज नॉट वर्क फ्रीली नाउ. तो डॉक्टर अमित जी, टेनिस एल्बो आई थिंक इज वन ऑफ द कॉमनेस्ट
Yes,
problem that we
yes.
see now. How often does this come up into your clinic?
Very often, and it's quite common condition. So, what is tennis elbow? Actually, in the elbow joint, we have 2 points: one on the inner aspect of the elbow, one in the outer aspect, and there are certain group of muscles which are originating from there. So, there is a repeated because the repeated stress and injury, there is inflammation in that point. So that is called as tennis elbow. Nothing to do with the playing tennis, but then yes, it is traditionally called tennis elbow. Management will include restrictions of the physical activities from that hand, and you can use some tennis elbow bands, some local anti-inflammatory medications can be applied, some hot fermentation. You can do go for physiotherapy for some time, and then some collagen supplements can be added. And in worst case scenario, we can go for local infiltration with the steroids. That also health actually.
G.
It's a curable
And
condition, can be managed.
uh, it is curable. Yeah, thanks.
Yes.
It's always very positive to hear such reiterations. It's always good to have that affirmation from doctor. Yeah, and Bikash Meherji पूछते हैं, Dr. Shekhar Reddy, would you want to answer this? I have wrist pain, and how can I help myself?
Again, see, any joint pain, uh, the patient has to be seen by a clinician. Then only we will be able to understand what's going on. After seeing that, and we will ask for few investigations, and then how to deal with it. Wrist pain, actually, there are multiple bones in a wrist joint. See,
Yeah,
they that I mean, maybe because of osteoarthritis or inflammation or any trauma, all these things will cause the pain.
correct. Now that after, according to my understanding and a lot of people that I see, after tennis elbow carpal tunnel syndrome is something that affects a lot of IT and the desk job people who have similar kind of movements. I suppose you must be seeing them a lot too in your
Lot.
clinics.
Yes.
Yeah,
Yes,
yeah.
definitely.
Okay, so next question. इतने सारे आज rheumatoid arthritis के questions हैं कि I suppose we have to address this once again, though we have answered this again. Um, Rashmi Bhatia ji पूछते हैं, I've been diagnosed with rheumatoid arthritis. Does it get fully cured, or do I have to take medicines all the life, Dr. Amit ji?
Yeah, that depends. As I said earlier, if you make sure that you are following a healthy lifestyle, healthy routine, it can be controlled to certain extent. Like diabetes, in diabetes, sometimes if you are taking good care of your diet, do regular exercises, sometimes you don't need to take medicines. With your diet and exercise only, you can manage to certain extent. Similarly, rheumatoid arthritis also, if you follow certain things in your life, there are chances that you might require very minimum medicines, or you may not need to take medicines on a regular basis. That depends. But in certain group of patients, 10 to 15% of patients, whatever you do, the disease will progress, and we have to escalate the medicines. Like initially some basic medicines, then disease modifying, we need to increase the dose, and then eventually we have to go for the injectables, biologicals. So there is a treatment ladder actually. We need to follow that. So it's
Yes,
a
yes, totally
customized
understand.
actually.
It's not like
Depends from patient
it's
to
not like
patient.
मैंने गोली लिया और वो खत्म हो गया,
Yes,
ऐसा
yes.
नहीं है, ये
No,
तो
it's like
मैनेजमेंट
a
का ही है.
custom. Every plan has to be customized according to the patient needs and requirement.
Thank you, Doctor. Dr. Shekhar Reddy garu, here's a question from Mr. Kandasamy Ramanathan. I have lower back pain due to L5S1 arteriolisthesis, GR. I grade 1, I'm sorry. Will
Anterior
stem
is
cell
this.
therapy,
So it's this.
yes, yes. So will stem cell therapy help pain control? What will be the approximate cost of the treatment?
Now the thing is basically when there is a listhesis, there will be slipping of vertebra one over the other. This is the two vertebrae, right? You can see this. There is a slipping of one vertebra over the other. When there is a listhesis, usually the treatment will be
Can you
stabilization.
get it into the center, Doctor? Yes, yes, Doctor. Huh. Yes, sir, that's good. Good to see.
See, now this is the vertebra one over the other when they slip anteriorly, and there will be stretch on the cord. This is the spinal cord. What is there inside? Okay, and along with that, that drags the nerve roots. These are the one nerve roots which they carry the motor and sensation, means they are responsible for the moment and sensation. So usually the treatment will be stabilization and decompression and surgery for listhesis.
Yeah, yeah.
So
So sir,
this,
ये फिर हमें
regenerative medicines may not be useful.
okay, they might not be useful, Kandasamy Ramanathan जी. So आपको सर्जन के पास जाना पड़ेगा. बोले तो डॉक्टर अमित कुमार जी, what do you suggest?
Yeah, initially for some time conservative management can be tried for grade 1, because grade 1 is a very mild listhesis. But the if patient is not responding, then definitely surgical fixation and decompression is the only option.
Yeah, yeah, yeah. I totally understand and appreciate your answer there. Next question is Mithun Ghoshika. I'm going through R5S1 space reduction. What to do, Dr. Amit?
It's a degenerative spine actually. Joint space reduction is a sign of osteoarthritis of the spine, you can say, wherein there is a minimum height for the spinal disc that is reduced because of the excessive pressure. So initial management will remain conservative, reduce your weight, make sure your posture is good, because sometimes if people are working from home, they are lying down in the bed, on the sofa, couch, so they are not taking care of their back. So bad posture is one of the main reason younger population to present with this type of symptoms. And do regular exercises to strengthen your core and the paraspinal muscles, so that you don't put a lot of pressure on your spine. So these are the basic things which you can start immediately doing at your home. And if it doesn't respond, then definitely you need further evaluation and management after that, right?
Yeah. Yes, doctor. Here's a registered user's question. Mr. P.A. Reddy, male है and last 20 years से diabetic है, 66-year-old है. Left leg joint is very painful for the last 3 years, and he's a diabetic patient. What options do we have for diabetics, and how diabetes does affect the joints? Dr. Shekhar, would you want to add something here for the elderly?
Sure. See, actually, the diabetes, diabetic acropathy and arthropathy is common in advanced uncontrolled diabetics. So, wherein the diabetes is under control, usually they will not have this progressive arthropathies. But is a mono arthropathy means actually single joint is telling. That's what I understand by the question. If it is a single joint, see, we have to see whether there is a trauma or the single joint osteoarthritis or any infection of the joint. Diabetics, they tend to have the inflammatory and infective arthritis, also septic arthritis. So then we
Yeah.
can treat the problem.
But in general, Dr. Amit Kumarji, how does diabetes affect joints? Does it have a direct effect in joints, and how does it, pose a restriction for surgical options or any other procedures?
Yeah, diabetes for a very long period of time, let's say 20 years, as the patient said, they will have, they will have a neuropathy. We call it diabetic neuropathy. And neuropathy, the patient will not be knowing exactly when will there will
Yeah.
painful stimuli, patient will not be able to tell. So we call it a diabetic joint or the charcot joint kind of presentation, wherein the patient is not knowing and they are injuring their joints. So the joint will be totally distracted. When you see the X-ray, but patient will say, "I don't have the pain." So pain is not. This is one of the exceptions. The patient should
Present.
understand. If they are diabetic, they should not wait for the pain to come and then consult their doctor. Whenever there is a mild swelling or anything, immediately they should, because they will not complain of pain most of the time in a chronic diabetic. Immediately consult the doctor, and then we can take appropriate actions according to the stage of the disease. That is typical and characteristic of diabetic.
Very
And
true, doctor. Anyone with
yeah,
diabetes should be specially aware
very
of this and then
especially
manage.
diabetic foot. There are a lot of cases of diabetic foot. There they will develop the ulcers over the foot, over the sole, and there's a chronic non-healing ulcer, and it take ages to heal them. There are various surgical options we have to follow to manage them. They are prone for infection because of the diabetes. The infection will not go away. We will have a
Totally right.
osteomyelitis or the infection of the bone. And whenever you do any surgical procedure, again because of the diabetes, the wound healing is very slow. So they are again prone for infection. So they, all these things we have to consider in a diabetic patient.
Yes, yes. So here's a
Jans-
question.
Jansigar, I would
Definitely.
like to add add a point
Yes.
here. The thing is, pain always we think that it is bad, but pain is very good and it's protective. When you don't have pain, you don't know what's happening. As Amit said, in diabetics and leprosy patients, they don't have sensation. The damage will happen by the time you realize. The pain is protective.
Very nice. Pain is helpful and protective. That's nice. Learning space इनका नाम नहीं दिया है, but male है, 43-year-old है, I have fibromyalgia and arthritis. But my RH factor, anti-CCP, HLA, B27 all are negative. But pain continues and deformities have started. I take medicine L rheumatoid 25. Kindly suggest how to manage. Dr. Amit, would you want to add here?
So they have been diagnosed with fibromyalgia, isn't it? What they said?
Yes,
No, no, no.
fibromyalgia and arthritis, but RH factor and all are negative.
Yeah.
Yeah.
Fibromyalgia, you
Yeah,
can say it's a like, yeah, Dr. Sekhar, you're saying something?
yeah, I would like to answer the
He would
question.
want to add.
Fibromyalgia.
Please
Yeah,
Right.
continue with.
fibromyalgia thing is the fibromyalgia is the most common diagnosis what we encounter nowadays, especially after COVID. The fibromyalgia is a disease of exclusion. See, you will not find any organic problem or any damage anywhere, but the person or the patient tend to have pain everywhere in the body. It's a fleeting type of pain, and usually, so when you take the history of the patient, there may be some psychological trauma associated with it, and which will lead to the pain. And especially, I see the young mothers, and they were see are single mothers and single parents, and this needs to be addressed properly. No, there is no cure by surgery or treatment. Only medicine and disease, cognitive behavioral therapy, it can be treated.
Okay. Yeah. Dr. Amit, would you want to continue, please?
Yeah, yeah, definitely. In fact, I'll rather say any pain which is chronic and not responding to the regular medications, we have to dig into the history and find out whether is there any emotional stress, anxiety, depression, all these things. They actually they share the common neural pathway. Serotonin and norepinephrine. These are the chemical neurotransmitters which uh, have a role in the brain. So whenever you have a depression for a very long period of time, you might present with a multiple joint pain, unexplained joint pain actually. uh,
G. G.
Not only joint pain, you may have a various other disorders like related to GI. You can have a irritable bowel disorder or dyspepsia, or you may have a heart issues. You may have so many other joint. Apart from joint, another system will be affected. So that is also a important component, psychological aspect we have to address in all the patients. And fibromyalgia is yes one of them.
Yes, doctor. Thank you for answering this question. And next question are both our registered users' questions. So, Mr. Vijay Pratap Singh is 36-year-old. Sometimes I feel pain in both the knees and ankles with stiffness. Please suggest a solution. Also, Sajad Baksh, 37-year-old. My right leg pains throughout the day from knee to toe. What could be the cause? Yeah, and see, both of them are in 30s, they're mid 30s, 36 and 37. Both of them are male. Both of them are coming up with you with a similar kind of symptoms. What is this? How can you classify this kind of pain?
So any radiating pain from knee to toe, he's saying. So that is probably coming from the spine, most likely. We call it radicular pain or radiating pain. Surprisingly, when you order the investigation, you say that MRI of the spine, but they will say, I don't have any pain in the back. Why you are getting the MRI of my back? Why not in the leg or foot? But that we have to understand, it's radiating. The origin is from spine, right? And another patient, the first patient who is having the multiple joint
Pratap
pain,
Singh.
knee, ankle, yes, definitely they need further evaluation. Like sometimes uric acid is increased, they can affect multiple joints at a time, or maybe some we have to dig into the history to find out whether they have a family history of any arthritis. Sometimes they will say that yes, my parents have a arthritis, any collagen disorder or rheumatoid arthritis, or sometime ankylosing spondylitis. All these things need to be ruled out, so they
Yeah,
need
yeah.
further evaluation.
Yeah. Here quickly, खुशबू शेख आपने जो यूरिक एसिड का क्वेश्चन लिया है, I find a question about uric acid. खुशबू शेख, 28-year-old, obese है, suffering from gout, undergoing treatment. Last month I got tested for uric acid, which was normal range, but I still get knee pain and those crunching sounds when I go up and down the stairs.
When you have a gout or uric acid, your blood uric acid may not be high always. Sometime, because it may be normal in your blood, but it is high in the joint. But more specific ways to aspirate the joint and send it for the crystals, that is not practically possible. So
Correct.
once we have a history, we can treat according to the symptoms. So they have to make sure that they are drinking a lot of water, because water helps in washing away the uric acid, which is a byproduct of the protein. Another good thing is you can take plenty of fresh fruits, vegetables, and avoid high protein diet like paneer and egg, fish, chicken, mutton, alcohol. All these things need to be avoided. High protein diet.
Yes,
right?
I think
So
gout will be entirely separate session के लिए worth इतना information है. So we will. It takes a long time to understand and evaluate. All right, Dr. Shekhar Reddy. Next question is about pain management. Prem Kumar, 21-year-old male है. I have cervical spondylosis for 2 years. Can you please suggest me some solution for pain management?
Sure. The cervical spondylosis, there are multiple reasons for the cervical spondylosis. The pain arising from the cervical pain radiating to the hands, upper arms, and the neck, and sometimes they have the cervicogenic headache also. So these may all the reasons. But we should see what is the problem, where exactly is the problem. The cervical spine has multiple seven vertebrae. In that, there are multiple joints in between the vertebrae. Any of the problem from the sponge of the disc between the cervical vertebra and the joints, they may give rise to the cervical spondylosis. So this can be treated by the small simple injections. If that is not able to cure the problem, it can be they may need to go for surgery. But usually
Yeah.
the 90% of the time they don't need surgery.
Yes.
first,
Yes. Yes.
I would like to ask one question to the patient: what is the screen time? What is their
No,
screen
this is
time?
not just him. It hits us all. That question is
Yes, yes.
directed to all
So
the
first,
viewers.
they need to reduce their screen time, because what we have seen, most of the patients, especially after COVID, no, we all are glued to our screen. Our bank, our shopping, everything has come to the phone, and we are
Yes,
flexing our knee, bending our knee, and most of the time, uh, watching the anything, mobile or some sort of
yes,
screen is there
Ergonomics.
right.
always. Yes,
We
yes, yes.
are.
So we need to cut short that
Yes,
screen time. That is most important.
yesterday, you will not believe, doctor, I found somebody walking on a busy street with a phone in their hand. I said, this is even more putting not just your own joints, but putting everybody else in problem. So our screen and addiction becomes an entirely different topic or a discussion for another day. I'll keep that and move on. While you're talking about exercise and being mobile and posture correction, let me also put this Ritvik Bhattacharji's question. Strengthening of main muscles by weight training. How good is that? And joint support के लिए how to maintain bone density as we get old. Anything with Dr. Amit.
Yeah, strengthening of exercises. There are opposite set of muscles in every joint, like flexors and extensors, like quadriceps and hamstring. So we have to balance both of them. That need to be understood. Whenever you are going, start with the basic things directly. Don't go to the gym and start doing. You need to be proper. Hydrate yourself before going on for any exercises. Do the regular stretching and warm up. That is the biggest mistake. They don't stretch. They don't do. Uh, these things, and then end up with the muscle injury and muscle tear. These are the
Which
basics.
is yes,
Yes.
yes, yes. But then regular exercise, how would you promote this, Dr. Shekhar Reddy Garu, and how mobile we should always be active and mobile?
I always tell people eat healthy, work healthy. That's what I say. So you have to eat and work. Never rest your body. So do the for example, housewife is there. See, I prefer all the housewives should be doing their household chores so that will keep them fit, and a software engineer will be there. So you will be sitting in a chair and continuously looking at the screen. Instead, so when they are doing that, they should adjust their work ergonomics. That's what it is called. So dynamic ergonomics, the screen level and chair. But the activity is always important. The one more thing, the people those who work out, they do in the night saying that they don't have time. That's wrong. After having dinner, never go for workout. When you have food, you have to rest your body, and early mornings are the best time to work out. Even evenings also okay, not bad, but before you have dinner. And
How about
try
walk,
to
doctor? How about a
pardon?
simple walk or a brisk walk?
Yeah, yeah, that's what I'm telling. See, you need uh, to never use elevators. Try to take staircases and small distance also. Never take out your bike and go to buy something. So these are all very important thing. And in house also, see, you sit and you order your housemate to get everything. Don't do that. You walk, you go and get it. Even simple steps at home also will help you. That's what
Keep
standing
moving so
and
that your
walking
joint
are
is
very
mobile.
yes. Yes.
Yes.
Without
Okay.
mobile, be
Quickly,
mobile.
yeah, wonderful. Would you want to repeat that, doctor?
Yeah, so be mobile without mobile.
Correct, correct. So I'm running short on time and a lot of questions around. So heel pain is something that a lot of people are asking. Mohammad Imran ji hai and I forgot her name, Anupama. Having heel and leg pain. A lot of people are asking. Dr. Amit, would you want to
Yeah, it's called
explain?
plantar fasciitis, heel pain. That could be many reasons. One is definitely gout. Uric acid is one of the very common presentation of gout. Then we have to do the X-ray and see there is some calcaneal spur or there is a bony outgrowth in the heel. So that need to be addressed. We can advise some exercises, stretching of the plantar fascia, and we can use the silicone insoles that will provide a cushioning to the heel, and then they can go for some hot fermentation. Hot and cold contrast bath also can be helpful, and activity modifications, like if you have a prolonged standing job, you can take a break, something like that. And like if you're running, jumping, all those sort of activities, those also put a pressure on the heel. It causes a repeated tendon and ligament injury, so that also need to be taken care.
Yes.
And
So quick
in advance,
question again. Nitin Godbole's question. 47-year-old vitamin D can I supplementation के बारे में. A lot of people are asking what kind of supplements will help and what kind of supplements should we take and who should be taking supplements. Let me combine all these questions and ask you. D, calcium, कुछ भी बोलिए, ग्लूकोसामाइन इतने सारे आजकल ओवर द काउंटर मिल जाते हैं. So what would you suggest?
no, nowadays there is fashion of taking supplements, so I'll discourage it. We should focus more on taking healthy diet, like you can take calcium and vitamin D rich diet like dairy products, milk, paneer, curd, all those things are there, green leafy vegetables. Rather than taking supplements, they should focus more on taking a healthy diet and do regular health checkups once in a year. That is very much advisable, because what we have seen, patients, they will not have any symptoms, not much symptoms, but when they do the health checkup, they will find their sugar is high, cholesterol is high, and vitamin D is low. So we can predict, something which is coming up. They might be symptomatic in a few months period of time, and when we supplement them, we correct those things, they'll be all right.
So
So
it
that
should
is
not
my
be a
take.
daily supplement. कि daily dose की तरह मत लो. हो गया.
No, no,
So
no.
Mr. Godbole's question, I mistook the question there, doctor. Uh,
I just want to add a
Sorry,
point
Shekhar.
here.
Please
After
add.
this,
Yeah.
during this COVID era, many patients are coming with vitamin D toxic.
Yes, yes, yes. You're right.
Vitamin D
They've
toxic.
been popping. They've been popping pills like anything.
Right.
Oh my
So अति
God.
सर्वत्र चाहिए.
Be careful. Let's be cautious. I think this is the kind of alert that doctors have sent us. We should all be conscious in taking our supplements only with prescription. That's it. So Nitin Godbole ji का question मैंने mistake किया था. इनका age है 47, 67 kilos है. Uric acid 6.9 to 8.2 पे बढ़ गया है. Should I continue my tablets, Xyluric 100? That's a question that he has asked.
Then again, he need to consult his clinician, because there are so many other factors we need to see whether he's symptomatic, how much the symptoms
Yes,
are.
yes, totally. So, pain and winter में मुझे pain ज़्यादा आता है. Mr. Swaroop is asking, does our climate, temperature, weather, and humidity, moisture, all these affect our pains and joints?
Yes, definitely. It has been proven by science that decrease in the barometric or atmospheric pressure causes the irritation of the nerve endings of the joints, and they will also cause the tissue around the joints to swell up, leading to the stiffness and pain. So there is a science behind them, and you will notice that in old times, our grandmothers and all, they used to say that yes, it is about to rain without anything, because they can feel that same thing in their joints beforehand.
Yeah, yeah,
They
yes.
can predict, yes, it's about to rain.
Okay, great. So here's Palkirat Singh. I'm 45-year-old. A few years back, I used to play cricket and bowled. Thereafter, my right shoulder started paining. I took treatment and drugs, but no effect for last 4 months. doctors say it's a ligament problem. Dr. Shekhar Reddy, you must be experiencing these such cases in your clinic as well. कि ये injuries होते
Yes.
हैं, sports injuries.
So see, as it happens
Yeah.
actually, the people, especially
Yeah. So
sports,
what kind of?
they come to our clinic, and depending on the damage of the ligaments, if there is a lot of damage in the shoulder joint is a complex joint without much support. All the support is with the soft tissue and ligaments. So it is called shoulder girdle. In this, multiple ligaments will be there. Depending on the damage, if there is a tear, complete tear of the ligaments, it has to be repaired. And there are advanced treatments, arthroscopic treatments for the repair of the joints, and Amit will add to that. And from our side, we offer this regenerative medicine. Wherever there is a partial tear or damage, we do PRP injections into the joints, and that will help them heal
Yeah.
and relieve
Yeah.
them of the pain. And Amit will add a bit.
Yes, Dr.
Yeah.
Amit,
So
here's a question about Brahma Tyagi ji ka question hai. I want to know for my mother who's about 78-year-old suffering from knee pain, is it possible to treat without knee replacement? Because this is something that I wanted to specifically
My
ask.
question.
Ki without surgeries, without replacements, a lot of people do think that surgery is not the answer. But what is your
yes.
opinion on this?
Yeah, there are few options wherein we can like put the braces also. Offloader braces can be helpful, and then doctors, as Dr. Sekhar sir said already, they can go for nerve ablation therapies that will also give pain relief for certain period of time. So these are various options. We can give intra-articular injections also to relieve the pain for certain period of time. Although they all are not curable, obviously, but then at least we can have some pain relief for certain period of time, maybe 6 months or a year or so.
Okay. Here's another question. Tech and hardware, sir. My meniscus surgery was done 3 months ago. Left knee, but my pain is still there. I'm not able to walk and long runs. My age is only 22. So these are young people
Yes,
who are suffering.
sports. Yeah.
Hmm.
Sports
You
injury
wanted
is
to add
quite
the last sports injury as well, doctor. Please continue.
so sports injury is quite common in younger population, and they has to be if there is a definite tear, as the last patient who is having the shoulder pain for last 4 months. So first we have to diagnose it, and MRI is the wonderful modality to diagnose the exact grade of tear. If it's classical grade 3 tear, we need to operate and do the repair, most likely by doing the arthroscopic surgery. Right. And if
Yeah.
surgery has been done and then still he's symptomatic, then he need to consult the surgeon who has operated to find out what are the issues why he's having still pain. So there may be some corrections of the exercise protocol or regimen wherein we can target the real issue.
Yes, doctor. Quickly, we will sum it up fast. Karthik's mother's age is 55, recently diagnosed as stage 1 osteoarthritis. Doctor suggested hyaluronic acid injection or plasma therapy. Should we go ahead with it? How to reverse it? Dr. Shekhar Reddy, would you want to advise?
Yeah, see, as Amit mentioned, so there are multiple injections which are tried into the knee depending on the damage. If it is grade 1 and grade 2 arthritis, definitely these injections will give relief for some time. But if it is a grade 3, beyond that, the surgery is the only option.
या बट डॉक्टर अमित जी सर्जरी के बारे में आजकल थोड़ा अवेयरनेस बढ़ा है स्पेशली रिप्लेसमेंट एंड पार्शियल रिप्लेसमेंट के बारे में बट स्टिल पीपल डू हेजिटेट सो थोड़े सर्जिकल एंड नॉन सर्जिकल के बारे में क्विक ब्रीफ दे सकते हैं
Yeah, obviously surgical जितने भी options होते हैं, we keep him for the last. We never encourage. It has to come from the patient. We try to manage them, starting from lifestyle modification, exercises, and all conservative methods that includes the supplements for the joint, braces, and intra-articular injections like biological therapies. They are more now, what I've seen, patients are more comfortable with the biological therapies, PRPs and growth factors injections in the joints and around the joints, and they work actually for to certain period of time. They help, but after some time the patient will themselves, they will feel that we are not responding, and then they need to pop in painkillers very often. That is the time where they will they need to be proper, counseled. They need to be guided what surgical procedures we are going to do, and what are the pros and cons. Once they are fully informed, I think they can take their decisions. And nowadays we have a very good implants, very good improved technique, surgical techniques have been improved. We have robotics, so nothing to worry about. Even they have to go for surgical options.
Great. So, Dr. Shekhar Reddy, thank you. And we will conclude this. I'll not be able to take more questions because of paucity of time. I hope doctors have answered similar questions before as well. I hope my audience will understand this crunch of time, and we shall get back to this topic very soon. We promise you. But Dr. Shekhar Reddy Garu, before leaving, we want you to give us top tips of management of pain, the right time to approach doctors, and the options of pain management. Top tips from you, please.
So as I mentioned in between, actually, see any injury or any pain, see don't neglect it for more than 3 days. So do see a doctor. And any pain which is troubling you for more than 3 months, and you should see a pain physician. Don't see any other doctor. Go and straight away see a pain physician. By then you must have visited multiple doctors, and especially the pain is back pain, neck pain, shoulder pain, or even headaches also, which are being treated for a long time but no response. But we have simple solutions and simple treatments for all these problems. Apart from that, the people, those who are suffering from cancer and who are waiting for the death. So I always feel that they should have a peaceful death than a suffering death. For that also we have multiple solutions with simple interventions, and we don't dump those patients, those who are waiting or palliative care, them with multiple medication wherein they don't recognize their relatives, or they will not be able to eat or drink, and they will be always groggy. So for them we have multiple options. But any pain, but should never neglect any pain, and that's what I always feel. And in India, unfortunately, the pain physician or the pain specialty is not very, well known. But nowadays there are multiple pain specialists who are working on this. And see, this is not to downplay with any other physician, but the pain has to be treated properly. Uh, so when you understood the pain properly, then you will treat it. That's what I feel. So never neglect. See a doctor when you have pain. If it is not reducing for 3 days, and see a pain physician if you are not relieved of pain for more than 3 months. This is the top tip of the day. Please take it home and follow. Thank you.
Thank you. Thank you so much, Dr. Shekhar Reddy. One quick question to Dr. Amit Kumar ji before we go for the top tips. Here's a registered user who's asking, is congenital scoliosis curable?
Surgical options again. If it's severe, we have to measure the angle. If it's on a higher side, then surgical options are there. Yes, it can be cured.
What is, doctor, just to
But
understand the term?
scoliosis is a spine is usually a straight thing, but when there is a snake like, there will curve in
Okay.
the spine, so that is called as
Ah, that is
scoliosis. Yeah,
it.
exactly.
Okay, doctor, got
So
this
in
fine
younger,
picture to show.
yeah, in younger patients, we can use the braces. There are braces which can be used to mold the spine in a correct alignment. But then in relatively elderly patients, not elderly, I mean relatively uh, aged patients, wherein deformity is too high, we need to do the surgical corrections.
All right, doctor. So with that, I thank you, and then I want top tips from an orthopedist to manage joint pains.
Yeah. My top tips are very simple. One is keep your joints mobile because they have been meant to be moving mobile, and keep do regular exercises, take healthy diet, and do regular health checkups, and keep your body weight under control. Follow ideal body BMI, and whenever your symptom persists for a certain period of time, consult your clinician because you should not ignore any joint or bone related symptoms. Thank you.
Wonderful. Thank you, doctors. It has been a very happy Sunday, and we
Thank you.
appreciate your time on Sunday. Thanks, Dr. Shekhar Reddy Garu and Dr.
Thank
Amit
you.
ji. Thank you.
Thank
Namaskar.
you.
Thank you. So with that, we take leave from our Apollo Health experts, but I leave you for answering my questions. I want to place my questions on the screen. Here's the health quiz coming up. Type your answers in the chat box and you will win prizes from Apollo 24/7. Gift vouchers will be shared with you. If you are the winner, I'll be announcing the winner's name towards the end of the show. And if you are declared as a winner, you'll have to write back to us at marketing@apollo247.com. And winners will be declared, selected at the sole discretion of Apollo 24/7 team. Here are today's questions. आज के 3 questions हैं. The first question is state in true or false. Question number 1. Only older adults develop arthritis. Is this true or false? Only older adults develop arthritis. Is this true or false? Question number 2. Fill in the blank, please. Humans have dash joints. कितने joints होते हैं? Number डाल दीजिए वहां पर. Humans have dash joints. Fill in the blank there. Question number 3. Yes or no में आंसर कीजिए. Does joint pain cause insomnia, sleeplessness? Yes or no कीजिए. Does joint pain cause insomnia? These are the 3 questions for the day. I see a lot of people are answering. Palkirat, Sonia, Hemant, Karthik, Jolly Singh, Zayan, Rajesh, Satat Banu. A lot of people are answering today. Go and type your answers down there and let's see who the winners are. In the meanwhile, let me quickly give you away the gift coupons, the discount coupons. The first one that we are giving you today is First VC, FIRST-VC. Use this on Apollo 24/7. You have to download the app and use this. When you do use this First VC code, you get 150 rupees off on the first online doctor consultation. So get doctor consultations direct from Apollo. And the next code that we are giving away today is First 3, FIRST3. Order medicines through Apollo 24/7 app. Direct from Apollo aate hai medicines. You get flat 25% off on the first 3 online medicine orders above rupees 1,000. And a lot of, you can use it for the first 3 times. Go ahead, download the app and use the codes. And for our Health Hour viewers who join us exclusively on the Sunday morning with their questions, here's an exclusive code for the Health Hour viewers, HH247. You get up to 199 rupees off on online consultation with Apollo doctors and up to 20% off on medicine orders. And this is exclusive. You can use this in addition to the other coupons that we gave away today. And next week के लिए एक छोटा सा announcement है. Next week है दिवाली का weekend. So as we are all gearing up to celebrate Diwali, let's all take a small break in Health Hour. So next Sunday, we are not going to have a Health Hour, but we shall see you on 30th October. That's the next week after Sunday. We shall see you with a very interesting topic, life after COVID-19. What are the new developments and discoveries? इतने सारे cases हम सुन रहे हैं about sudden cardiac arrest and then a lot of other lung issues, and we are seeing so much of development. Where are we? What is the risk? What are the new developments and discoveries? How has COVID impacted us? This is a very important topic. If you have been through certain issues, post-COVID issues, do join us. And 30th October, 11 a.m. है. YouTube and Facebook live होगा. If you don't want to miss this session, आपको क्या करना है? YouTube पे जाना है और subscribe करना है. Notification भी turn on करना है so that you get a notification alert. And here are the winners. Congratulations, winners. Palkirat Singh, Manjit Kaur and Neeraj Kumar. I repeat, Palkirat Singh, Manjit Kaur and Neeraj Kumar. Congratulations. Do write back to us at marketing@apollo247.com to claim your gift vouchers from Apollo 24/7. Thank you all. I thank our experts and all the audience who have joined us. Your question is not just your question, it's an answer for entire audience. Thank you. See you on the 30th.